So what I'm going to cover today is the importance of nutrition in the upper gastrointestinal tract and some of the nutritional challenges that come with upper GI cancer and treatment. We'll talk through managing symptoms, as well as some practical tips and strategies to keep you feeling your best. I'm also going to touch on alternative diets and complementary therapies. And like I said, I hope to have an opportunity to answer your specific questions towards the end of the talk. So the upper GI tract is comprised of many different organs, including the esophagus, the stomach, the pancreas, the upper part of the small intestine, the liver, the bile ducts, and the gallbladder. And what I'm going to do is talk through some of the really important roles of these organs in nutrition and digestion. So the esophagus, first up, I'm sorry that's cut off, you may know as the food pipe. So the esophagus is the pipe that connects our mouth, throat, down to our stomach. So it's got a few different roles and a few different things to be mindful of. It, of course, is responsible for the passage of food. And when there is cancer of the esophagus or any treatment that impacts the esophagus, swallowing can become difficult or painful. The gastroesophageal sphincter, or the valve that connects the esophagus and the stomach, is really important for preventing backflow of food and gastric acid into the esophagus. And if there's any issues with this here, the gastroesophageal sphincter, then we can experience symptoms of reflux. Now, I know from the audience that no one's listed themselves as potentially being an esophageal cancer patient, so I won't harp on too much about esophageal cancer, but for those perhaps who may be listening to the recording, in the instance where an esophagectomy is required, what generally happens is the stomach is dragged up and connected to the top part of the esophagus, meaning that the esophagus is removed and the stomach becomes both the esophagus, the food pipe, and the stomach, which can make things difficult from a hunger fullness point of view because the capacity of the stomach is reduced. It can also contribute to reflux, and some people may require texture modified diets. Sometimes stents are also used, and stretches or dilatations to keep this food pipe open or wide enough to allow food to pass through effectively. Then we move on to the stomach, which, as we know, is very important for the digestion and breakdown of food. The stomach breaks down food using chemicals, gastric acids, enzymes that actually work on food to break it down at a molecular level. Also mechanically important to break down food. So the churning and movement of the stomach muscle and stomach wall helps to break down food physically. And the stomach's also important for the absorption of some nutrients and water. In particular, things like alcohol and caffeine are absorbed directly from the stomach. Of course, the stomach's also a reservoir for food, so it holds our food and fluid when we eat or drink something. And if the volume of the stomach is impacted, then we may have more or less space for food. When the stomach is overfull, we can feel sick, can end up vomiting or regurgitating food, and we can experience reflux. And again, for those perhaps who are listening to a recording, in the instance of needing surgery for stomach cancer or gastric cancer, a gastrectomy may be implicated or may be used, and that would entail the removal of part or all of the stomach, and that can come with quite a fair host of side effects and symptoms, which would really benefit from nutrition support. The liver is really important for digestion and metabolism. It produces bile salts and products for breaking down fat. It also helps to store our excess carbohydrates that we use for energy. The liver is also really important for detoxifying our body, so it helps to process different medications, nutrients, waste, drugs, and damage to the liver can change the way that we digest and detoxify food. The pancreas. So we saw a lot of threes come up on my poll before, meaning a lot of you will be interested in the role of the pancreas. There's two major roles of the pancreas. The first is that of digestion. So the pancreas produces enzymes that are really important for digesting and absorbing the food that we eat. The second really important role is for managing blood glucose levels or blood sugar levels. The pancreas produces the hormones insulin and glucagon, which are involved in regulating our blood sugar levels. And so damage to the pancreas, whether that's through cancer or cancer-related treatments, can change the way that we digest and absorb food and can change the way that our body manages sugar. Now, to give a little bit more context on the digestive element of the pancreas, the pancreas produces digestive enzymes called protease, lipase, and amylase. And these break down protein, fat, and carbohydrate, respectively, from our diet. And the way I like to describe how pancreatic enzymes work is that they help to chop up things. So if we consider a protein or a fat or a carbohydrate as a long chain or a necklace, what the enzymes do is they help to cleave or break those chains into smaller links. And the links can then be absorbed by our body because they're small enough. Now I'm going to try and display that here in a picture. So if you can imagine that you've eaten a food and you've swallowed what we're going to imagine to be a chain or a necklace. That passes down your esophagus, into your stomach, into your intestines, where it's met with pancreatic enzymes. The enzymes then break down that chain to smaller links so that these little links can then be absorbed into our intestine and into our bloodstream. And once they're in our body, that's where we can use them for energy and fuel. It can help to keep our weight stable or to put on weight if we need to. And our output or our waste, what's passed through us in our stool, is quite regular, quite normal. Now I'm going to paint the picture of a pancreas that may not be functioning so well. Whether that's from cancer, cancer-related treatments, or other sort of injury, a pancreas that doesn't work so well may not produce digestive enzymes at all, or may not produce enough digestive enzymes. And what that means is that the chain or the necklace that you swallow doesn't get broken down into those smaller links, and it remains a long chain. And our body can't actually absorb that long chain. It's too big. And what that means is that we don't get to absorb the food that we eat properly, meaning we don't have the energy, the nutrients, the fuel from the food that we eat. And we also might end up with quite a lot of output or waste. Our bowels or our stools might become more frequent because what we're eating is coming straight out the other end. That can result in things like increase in bowel movements, weight loss and nutrient deficiencies, malnutrition, and feeling fatigued and weak because we don't have enough food being absorbed by our body. If we then think about the blood glucose control element of the pancreas, if it's not functioning properly, then we don't release the enzymes, the hormones that are required to process sugar. And we can end up either with low blood sugar levels or with high blood sugar levels. And some symptoms of those are listed here. So low blood sugar levels or hypoglycemia, some people might experience shakiness, feeling a little bit nervy or anxious, lightheadedness or dizziness, and a fast heart rate. And those who might experience high blood sugar levels might have symptoms like frequent urination, feeling really thirsty, having headaches or blurred vision, difficulty concentrating or brain fog, and weight loss. So I guess one thing I will say, it's really important if you're experiencing any of these symptoms to make sure you chat with your treating team to rule out any blood glucose issues or blood sugar regulation issues. Now we're going to think about upper GI cancer treatment and nutrition. And cancer treatment for upper gastrointestinal cancers can include multiple types of therapy, including radiation, surgery, chemotherapy, and all other targeted or biological therapies or immunotherapies. Now I'm going to do another poll or ask you guys another question. So I'll get you to open the chat and have a read through here. Which of the following treatments have you received or are you planned to receive? And I'd love for you to put one or more numbers depending on what treatments are relevant to you. All right, so quite a few with multiple treatment types, which is not uncommon for upper GI treatment. So we've got some surgeries and chemotherapy is looking quite common. Some with radiation as well. Stomach surgery, yep. Okay, so the most common treatment types that I'm seeing from the group here are chemotherapy, radiation, and pancreatic surgery. But a few others in the mix is there as well. So I hope to be able to shed some light on the different types of surgery and chemo that and radiation that you might have experienced or plan to experience. And again, happy to answer any questions you have at the end. So make sure you note down anything you'd like to ask me. So when it comes to surgery, the main surgery or the key surgeries that are used in upper GI cancers are esophagectomies or removal of some or part of the esophagus, stenting and dilatation, so stretching or putting stents or mesh wires, barriers to keep the esophagus pipe open, gastrectomy, so whether it's removal of some or all of the stomach, pancreatectomy, again, removal of some or all of the stomach, and a Whipple's procedure, which is a complicated procedure that includes removal of the pancreas, some or all parts of the stomach, and other gastrointestinal organs. Now, I'm very happy to share with you if you're wanting some more information on surgery and some of the nutrition implications of your particular surgery, please feel free to jump online to our store. I've made our guides free for anyone at PanCare, so you're very welcome to download those if you would like to read a little bit more in your own time and get a bit more information about what your surgery may mean for you and your nutrition. So the code to download these for free is PanCare 2022, and I'm very happy to share the links with Sonia or however it's best to get that to you. I'm happy to share it at the end as well. Now, a lot of you had listed that you have had or plan to have chemotherapy. And chemotherapy may be given before or after surgery to help control the disease or the symptoms. So in some cases, it's utilised to help minimise the extent of the surgery by controlling the tumour before surgery happens, and also to help mop up any additional or leftover cancer cells after a surgical procedure. Now, chemotherapy is what we call systemic, meaning that it affects the whole body. So because it's entered into the bloodstream, the side effects of chemo can be quite far-reaching. They can impact any part of the body. And you can see in this bottom box here that some of the side effects of chemo commonly are nausea and vomiting, changes to taste and appetite, feeling tired and really feeling quite overwhelmingly tired, ulceration of the mouth or throat, and changes in bowel habits are all really common. But it's important to note that just because they're common, it doesn't mean that they should be tolerated. There are ways to manage all of these symptoms, and I encourage anyone who has side effects from chemo to make sure they discuss those with their treating team to get some support. I've listed here some of the common chemotherapy agents, which often looks like, and biological agents, which looks like a bit of a different language, but you might be familiar with some of those terms there. And I also always like to make note of some potential interactions with food and nutrients that can happen alongside chemo. So in this box here, it's important to be mindful of vitamin, mineral, herbal supplements or supplements or powders that provide high doses of antioxidants. Antioxidants are wonderful nutrients. They help to keep our body and our cells really healthy. They help to keep our cells healthy by repairing any cell damage. And during chemotherapy, but also radiotherapy, we're actively trying to damage cells. And antioxidants, they can't distinguish between a healthy cell and a cancer cell. And it's important that we avoid high doses of antioxidants during chemotherapy, sometimes, to help make sure that we give the chemotherapy the best chance to cause that cell damage to the cancer cells. And we reserve the antioxidants for later, after chemotherapy, to help repair our healthy cells once the chemo's done its job. Probiotics is something to be mindful of too. In someone who's having chemotherapy, often their immune system is weakened and they become what we call neutropenic. And in someone who's got neutropenia, probiotic supplements are best recommended to be avoided because probiotics are bacteria and we don't want to introduce bacteria into the body of someone who doesn't have a very strong immune system. There are also a number of herbal supplements, teas, other ingestible therapies that can interfere with particular chemotherapies. Always really important to chat to your doctor, your dietitian, or your pharmacist to make sure there's no interactions with your cancer treatment. When it comes to radiotherapy, radiotherapy is the use of ionizing radiation to damage or destroy cancer cells. Now, it's a bit different to chemo in that it's quite localized or targeted. So if your radiation is targeted at, for example, your pancreas, then the radiation field is going to be quite tightly specified, so it only impacts the pancreas. Unfortunately, in order to get into the pancreas, sometimes we can get some collateral damage to surrounding organs, which can contribute to side effects. But it doesn't have the same systemic or whole body impact that chemo does. Some of the side effects of radiotherapy, really, they do depend on where your radiation is targeted. So for those who are having radiation to their pancreas, it's possible that you might experience nausea and vomiting because the stomachs may be in the field. You might have changes in the way your body processes food and your bowel habits may change. You might get changes to your blood sugar levels because of damage to the pancreas. And fatigue or that extreme tiredness is really common in any type of radiation as well. The side effects of radiotherapy, they do tend to accumulate over time. They tend to become more significant around about week 3 of radiation. And we find that side effects of radiation tend to peak in the last week and the week after treatment. So don't be surprised if after you've had radiotherapy, the week after treatment is actually the hardest week. That's because of the buildup of radiation in the system. The good news is that good nutrition and eating well will enhance your tolerance to radiation and also improve your recovery, so speed up your recovery time. Similar to chemo, there are some interactions that can happen with herbs, vitamins, minerals, supplements. So it's important to get the all clear from your treating team or your dietitian before taking any supplements. And in many cases, people will have chemotherapy and radiotherapy at the same time. And that's because chemotherapy is used to enhance the impact of radiation. So it makes the radiotherapy more effective. We think about now managing side effects. So the side effects of someone who's having upper GI or upper gastrointestinal cancer treatment can be quite significant and of course can have a massive impact on eating and drinking. This picture here depicts some of the side effects that might happen through gastrointestinal cancer treatment. You might experience dryness in your mouth, and that can be more debilitating than it sounds. I can't tell you how many people complain the most about the dryness in their mouth. And until you've experienced it, it's really hard to understand how much of an impact that can have. You can certainly use artificial salivas and things to moisten your mouth. They don't tend to be hugely effective. They last about 20 minutes, but I encourage you all to try them if you haven't and you need them. There's also a product called Xylee Melts that I'm happy to link you to that help to actually stimulate your own body's production of saliva. They can be quite effective, particularly overnight. Changes in taste is quite common with chemotherapy in particular, and there's no one size fits all here of how to manage that, but some people find that metal cutlery can actually make things worse, particularly if they've got a metallic taste. So changing to wooden or plastic cutlery can be helpful, and making sure you've got a clean, fresh mouth, and experimenting with different flavors, temperatures, and textures too. Because if you can't taste your food, you can still get some sort of sensory enjoyment if your food crunches or melts in your mouth or pleases you in some other way other than just the taste. Reflux is quite common, particularly with chemotherapy or any radiation that impacts the esophagus and also with any surgery. Certainly anti-reflux medications can be quite useful, and avoiding acidic foods, spicy or greasy foods, and positioning yourself so that you're not lying down too soon after eating can be quite useful. Nausea and vomiting is really common, and using medications to help manage nausea and vomiting is really useful, particularly if your nausea is caused by medication or drugs, treatment. Often you'll need medication to help manage it. I encourage you all to figure out or to ask about how the anti-nausea medication works, because they all work in different ways, and some work better if you have them just before you eat or a little bit longer before you eat. And certainly when it comes to food, there are things you can do to help manage nausea as well. Sometimes food smells can be quite off-putting, so using cold or room temperature foods can be useful. And small, frequent meals can be more tolerated than large meals. And using sort of bland, starchy foods can be helpful too. Excuse me. Swallowing and slow transit can be quite difficult, particularly with surgery to the upper GI tract. Excuse me, got a tickle in my throat. Over here to fat malabsorption. Goodness me. Fat malabsorption is quite common in people who've got pancreatic cancer or have had treatment to or damage to their pancreas. That's something I'm going to talk a little bit more about coming soon, so we'll hold off on that. Dumping syndrome can be quite a unique and challenging side effect, particularly when someone's had surgery like a Whipple's procedure or any sort of stomach surgery or esophageal surgery, where the lower part of their stomach has been damaged. It can change the way our body processes food and how quickly food moves through our system. And there's certainly lots of ways we can help to manage symptoms of dumping syndrome. So if you experience any symptoms of feeling particularly nauseated, having lots of diarrhea or frequent stools after you're eating, or if you're getting a fast heart rate or feeling quite dizzy or fatigued or shaky after you're eating, I encourage you to raise the question of dumping syndrome, particularly if you've had your stomach, if any surgery to your stomach. Vitamin and mineral absorption can certainly be impacted, particularly with pancreatic surgery, and it's really important to be mindful of really important nutrients that are absorbed by our intestines that need fat to be absorbed, and these are our fat-soluble vitamins, so vitamin A, D, E, and K, but also vitamins and minerals like vitamin B12, iron, calcium. They can all become low when we're not absorbing food properly. So you can get blood tests to check for these. I'm very happy to guide anyone on requesting a blood test if they're indicated, and making changes to your diet or adding supplements to make sure you're not deficient in particular nutrients. When it comes to bowel changes, bowel habit changes, this is really common in people with upper GI cancers. And often it's something that it's almost like your body's wanting you to ask more questions and pay attention to it. If you're experiencing diarrhea, look for signs of fat malabsorption. And the signs of fat malabsorption are if you've got pale, floating, or smelly, particularly smelly stools, that can be a sign that your body's not absorbing fat very well, and you may need some pancreatic enzymes to help your body to absorb your food properly. Other people can get diarrhea because of things like FODMAP intolerances or irritable bowel symptoms, and dietary changes can be really effective there too. And when it comes to constipation, in many instances, constipation can be caused by medications. And if that's the case, certainly diet can help, but in many instances, medication will be required to help manage your constipation too. So making sure you're talking to your doctor and dietitian team about how best to manage constipation, particularly if you're going more than 2 days without using your bowels, or if you have any associated pain or cramping. All right, I'm going to ask you guys another question. So get the chats open and ready. And that is, if you feel comfortable sharing, of course, it's very optional, how would you describe your current body weight? Is it quite stable? Have you lost weight recently? Have you gained weight recently? Or if you're a health professional, that's fine too. It's quite nice to see these numbers come through, because it might be a little bit reassuring for some people in the audience that there's a lot of twos there. A lot of people are finding that they've lost weight recently. And I want to reassure you that you're not alone in that. It's quite common. But again, just like side effects and symptoms, just because it's common doesn't mean it should be tolerated. There's things we can do about it, and I'm really keen to support you with that. Also really aware that there's people who've got stable weights or might have put on some weight recently, and if that's been intentional, amazing. I'm so happy for you. If you're needing any support around weight gain and how your body's processing food in that way, I'm very happy to answer questions you've got at the end as well. So weight loss is common in people with upper GI cancers, and that's because cancer itself, the treatments, they're impacting the digestion and absorption of food. So it's so understandable that it's hard to maintain your weight when your body is not breaking down and absorbing food as it normally would. Energy or calories and protein are so important for our strength, our function, our day-to-day activities. And the 3 key steps that I like to use when thinking about someone who's trying to maintain or stabilize their weight is to focus on building your meals and snacks around a protein base, adding a good source of fat, and then selecting a low GI carbohydrate to round out the meal. In many cases, it's recommended to monitor your weight reasonably frequently, weekly, fortnightly, just to keep on top of which way your weight is trending. What we don't want to do is to wait a month and all of a sudden you've lost quite a significant amount of weight that can be more difficult to come back from. So being mindful of what your weight is doing is really useful. Share that with your treating team and make sure you're getting referrals on to dietitians or other health professionals as needed. So if we think back to step 1 of our building our meals to help maintain the weight, we're going to start with a protein source. Now that might be an animal-based protein or a plant-based protein. They're all listed here. Really good sources of protein: fish, poultry, lean meats, eggs, dairy products, tofu if you like it, legumes, nuts and seeds, and also there's a range of different protein supplements and powders that are available if that's something that your body needs for a little bit extra. Step 2 is to add fats or oils. Ideally, we want to look for fats that are providing really good health benefits, in particular fats, omega-3 fatty acids and monounsaturated fats. And we can get those from plant-based oils, so extra virgin olive oil is fantastic, sunflower, flaxseed oil, sesame oil, peanut oil. Use them really liberally when you're cooking, but also dressings and drizzling on top of things like veggies and pasta to give you that extra boost of calories. Avocado, nuts and seeds, nut butters are all great choices for those healthy fats too. And of course, coconut oil, butter, and other spreads are the sources of fats. They're probably not our first choice, but wherever we can get energy and calories and fat is useful. Now, it's really important when you have pancreatic cancer that if you're showing any signs of fat malabsorption, in particular if you're getting abdominal pain, pale, floating or smelly stools, then it might be that your body requires enzymes or pancreatic enzymes or a product called creon to help break down fat. And some people find that a low-fat diet actually feels better for them because it means that they're not malabsorbing or they're not having trouble digesting their fat. Now, that's not a great idea for someone with pancreatic cancer because fats are a really important nutrient for us to include. A much better option is to make sure that you've got the right dose or you've been educated on how to use creon, pancreatic enzymes, to make sure that the fat that you do eat, you process it correctly. I'm going to talk to you a bit more about creon in a sec, but creons are used to break down fats and proteins. And so we need to take them if your pancreas isn't working properly. There are certain foods that don't require creon, and those are listed here. They're foods that have virtually no protein or fat in them. So things like fruits, jellies, cordials, black tea or coffee don't need any creon. Can I just ask, I'm going to go rogue here and add another question to the chat. Could you all put your hand up or add to the chat is how many people are taking creon? Maybe give me a yes or a no in the chat. Yep. Okay. All right. Good. This next slide is likely to be quite useful for you. So creon or pancreatic enzyme replacement therapy. It is so important if your pancreas isn't working properly because otherwise your body just doesn't have the capacity to break down and absorb your food. So there's some really key things to be aware of when thinking about creon. The first, I'm going to start at the top here. It only lasts 20 minutes. So if you're having a long lunch that maybe drags out 45 minutes to an hour, you'll need to take a second dose of creon halfway through because that creon's only going to cover you for 20 to 30 minutes. So if you're having a second, have a second dose if your meal is lasting longer than that. It needs to be taken at exactly the same time as your meals and snacks. The way that it works is it actually travels through the digestive system with that food. And if you have it too far before or too far after your food, it doesn't work. So making sure you're having it at exactly the same time that you eat. We often say, sit down, have your first mouthful and have your creon straight away. Like on the previous slide, there are certain things that don't require creon, but everything else does. So snacks, fluids, so even milky drinks, milky coffees or a latte or even an Nescafe with a decent dash of milk, and any fruit-based supplement drinks do require creon. So it's important you take them with everything. Otherwise, it's almost a bit of a wasted effort. What you're eating won't get digested or absorbed properly. You don't need creon for foods or fluids with no protein or fat. So the fruits, veggies, juices, jellies, soft drinks, lollies. Creon will improve the absorption of fat-soluble vitamins as well as fat. So it's important to take it so that you're not just getting the energy or the fat from your food, but also the vitamin A, vitamin D, vitamin E, vitamin K. We can't absorb fat-soluble vitamins if we don't absorb fat. I'm going to go back to the top here. Prion is enteric coated. So what that means is it passes through your stomach undigested, and it only gets released into the system once it hits your duodenum or your intestine, which is what's meant to happen. So it's important not to chew prion. And if you can't swallow the capsules whole, you can get granules or you can empty the capsule, but it's important to take it with something that's acidic. So something like an apple puree to make sure that it is preserved all the way through to the duodenum before it has the chance to work on your food. Everyone's dosing of prion is very, very different. It depends on you and your body, your remaining pancreatic function, but also the food that you're eating. So it's really important to be guided by a dietitian on how to dose prion for you. And someone's asked here, can you have too much? And yes, you can, but it's really, really hard to overdo it. So the maximum dose of prion per day is quite high. So for someone who might weigh 60 kilos, the maximum dose of prion is 24 capsules, 25,000 international unit capsules per day, which is huge. I've never seen anyone on a dose that's considered too high and unsafe. So very hard to overdo it, but very good question. Some people do experience changes in their bowel habits when they're on prion, and so speaking to your dietitian to get the right dose for you is really important, because of course we don't want to take more of something than we need. We just want to find that happy place, the right dose for you. It's important to know that there are interactions with antacids or any products that contain calcium or magnesium. So things like over-the-counter reflux medications, Gaviscon, Mylanta, can interact with your prion. So it's important to know when to dose those. And for anyone with a pork allergy or who's opposed to eating pork products for cultural or personal reasons, the prion actually does come from pork or pig products. So that's really important to know as well. The third piece of the puzzle, after you've based around a protein and you've added your fat with prion, is to ensure you're choosing low GI carbohydrates. The carbohydrates are our preferred source of fuel in the body, and so really useful to include carbohydrates often, but choosing the ones that fuel us well. So there's a list here of foods that are good sources of carbohydrates, but really important to know that they're not all equal. They don't serve our body all in the same way. And I'm sure you can appreciate that something like a whole grain bread or a legume or a sweet potato functions in the body quite differently to something like a donut or a soft drink. Now, this concept is important to relate back to what we call the glycaemic index. Now, if I go back to this slide, certain foods and certain food products are considered high GI and others considered low GI. And that changes the way that our body processes them and how they make us feel. So I'm going to take you to this graph again. The glycemic index measures how quickly a carbohydrate food is broken down and absorbed in the body. High GI carbohydrates are broken down really quickly and they send our blood sugar levels high and then they drop low again quite quickly. If we compare that to a low GI carbohydrate, they provide a more sustained release of energy over a longer period of time. So if you can imagine a high GI carbohydrate, we're going to get a rush of energy and then we're going to feel quite flat and fatigued soon after. Compared to low GI, we feel energized and stable across the day, which for someone who's got pancreatic cancer or upper GI cancer and is already really tired, this can make a big difference to how you feel from your energy levels across the day. And I'm sure you've all had a big lunch, big pasta lunch with some garlic bread, or you've had a big Christmas dinner or a birthday cake, and then a few hours later you're ready to fall asleep. This could easily be me falling asleep at my desk after a high GI meal. And that's the glycemic index coming into play. So a few different examples of high and low GI carbohydrate foods listed here. But again, I'm welcome you all to download for free our glycemic index guide if you want some more information, but also a shopping list on choosing low GI carbohydrates to keep you feeling energized across the day as much as possible, and to help prevent any highs and lows in your blood sugar levels. That can take a bit of pressure off your pancreas as well. So feel free to download that one for free. I'm happy to send links as needed as well. Now, this is something that we hear quite a lot. For someone going through cancer treatment, very well-meaning advice is to eat whatever you feel like. And while that's well-meaning, when you feel like this, ready to fall asleep on your plate, in your bowl of food, it's very unlikely that you're going to feel up to making a beautiful, healthy, balanced meal after you've had chemo or when you're recovering from surgery. So we need to be practical and realistic about what you can actually achieve when you're going through cancer treatment or you've got an upper GI cancer. Now, we'll just say I've seen some questions come through, and I've noted those. I'm definitely going to answer those at the end. So I'm not ignoring you. So one really nice way to try and meet your nutritional needs without expecting too much from yourself at meal times is to think about having high energy, high protein, low GI snacks. So smaller meals more often can sometimes feel a little bit more achievable than having 3 square meals. I've put some suggestions and ideas down here because one thing that can happen when we have smaller meals or smaller snacks across the day is it's really easy to miss out on important nutrients. And so it's important to be clever or wise about the snacks that you do have. So things like full cream yogurt, fruit, you might have some protein-based dips with some dense, grainy crackers. You might think about some protein balls or some ready-made protein balls or bars or snacks that you can get from the supermarket. I've got some great brands, very happy to support anyone with particular ideas if they're interested. Things like meatballs and falafel you can keep in the fridge, and a really good way to get that hit of protein and energy as a snack or a smaller meal. Whole grain toast, fruit toast, adding things like avocado, nut butters, banana, baked beans and eggs are great sources of protein. And things like smoothies and nourishing drinks, whether or not that's using a protein powder or a supplement, can really make sure that you get that little bit extra that your body needs, particularly when you don't feel like eating much at all. Now, some people may be recommended to include nutritional supplement drinks, whether they are commercially made, so things like Sustagen, Ensure, Fortisip, or homemade versions. You can, if you've got the energy and you've got a good blender, you can certainly make your own, but those commercially made ones can be really convenient, a good way to get in lots of energy in a small volume. Often they're high energy and high protein, so they can function as a meal replacement as needed, but also as an extra to make sure that you're topping your body up with the extra things that you need. In some cases, depending on your treatment type and how challenging you're finding it is to eat and drink, sometimes enteral feeding or feeding tubes are required. And that's something that your doctor and dietitian will talk to you about if it's needed. But it's also something worth considering if you're really having a tough time eating enough, that a feeding tube might be a nice short-term way just to take a bit of pressure off you, to make sure you get all of the energy and nutrients that you need when you're finding it difficult to eat enough. And I'm happy to answer any questions about feeding tubes as needed. They can seem a little scary, but in most cases, people find them a huge relief takes a lot of pressure off. If you're wanting to know more about, in particular, increasing your intake of energy and protein, so nourishing your body with the nutrients it needs, there's another guide here you're very welcome to download for free. I'm throwing all of these guides at you because I want you to have as much information as possible. And do keep in mind too that our team worked really closely with the PanCare team to put together some really awesome handbooks that are available as well. So I'm sure you've seen those on the PanCare website. Make sure you jump on there as well because there's some awesome tips that cover off a lot of this information as well. Now, next up, has anyone ever Googled how to stop hiccups? Have a look because it's pretty funny the sort of responses you can get. Drink a glass of water with a straw and block your ears. Number 3 is my favorite. Go and get a rectal massage to stop hiccups. Very strange, some very quirky things you can find on the internet. Similarly, if you were to Google dietitian, you probably assume that we all wear white lab coats all day, every day, and that we survive solely on a diet of green apples because every picture of a dietitian looks the same. And if we Google diets to cure cancer, we also get some equally questionable results. So I just want to point out, and I always like to flag, that there are lots of alternative diets and information out there that may be misleading and inaccurate. And it's important to know that everybody eats, and so everybody has got an opinion about food. Everybody is different, and so everybody feels different and processes food in very different ways. So important to be mindful that there are no diets known to reproducibly cure cancer or prevent cancer recurrence. If there was, it would be mainstream medicine. And what I want you to be aware of is that changing your diet or following alternative diets that claim to cure or prevent or manage cancer can be quite damaging and dangerous. It can be harmful to your health, it can be harmful to your mental health because it's exhausting and difficult. Socially, it can be really hard to be able to follow a restrictive diet and still be able to eat with your loved ones and enjoy social occasions. And they can also be really expensive with lots of added on supplements and herbs and vitamins that are required. So my advice here is to always be skeptical and always ask an expert. Make sure you get your facts checked before you make any significant changes to your diet. Complementary therapies and supplements. So there are lots of different vitamins, minerals, herbs, and other preparations that we can use to help enhance our health, many of which do a great job to help manage things like our symptoms and side effects. Some of them have got a really sound evidence base to support them. Things like ginger alongside chemotherapy has been shown to help manage nausea, particularly when taken in accurate or appropriate doses. Vitamin D can be really helpful after a cancer diagnosis to help make sure your energy levels are maintained, your immune system's working well, and may even change or reduce the risk of cancer recurrence. But there are also different vitamins and minerals that may interfere with different treatment types. So I mentioned a few earlier, antioxidants, probiotics, but also things like protein powders and vital greens, different types of nutrient powders and preparations. They can interfere with certain types of treatment. So always be mindful to ask your treating team to check that they're okay and safe to have alongside your treatment before you have them. I'm very happy to answer any questions that you might have about complementary therapies or supplements. Where to go for more information? So it's important to know that everybody is so unique, and each and every one of you in this audience here is going to have different questions, concerns, and different nutritional needs. But it's not a one-size-fits-all. So making sure you get some support from an oncology dietitian is really, really valuable. Even if it's once off, to make sure that you're on the right track and covering all bases to keep yourself well now and well into the future. It can be a really nice connection to have. Your treating hospital is certainly the first place to go to see if they can link you in with a dietitian. The PanCare support line is wonderful, and they've got some amazing nurses and professionals there to support your health and well-being. You can also access an oncology dietitian locally through the Dietitians Association of Australia. They've got a Finding a Dietitian section on their website where you can type in where you live and make sure you specify oncology or cancer care as the area of interest, so that you filter out individuals and professionals who have got an understanding of cancer care. And one thing to know is that the World Cancer Research Fund recommends that anyone with a cancer diagnosis, past or present, should seek nutrition advice and exercise advice from professionals. So it's encouraged that everyone seeks support from a dietitian and from an exercise physiologist or a physio. So make sure that if you haven't already linked in with someone, chat with your GP, chat with your oncologist, and see what they can do to help support your health in a really holistic way. There are care plans available, so Medicare and your private health fund can support you with rebates to ease that financial burden as well of any private consults. This is me. My team at OnCore are a group of oncology dietitians who are very, very passionate about managing and supporting people with upper gastrointestinal cancers. You're very welcome to write down my email address. I'm Lauren Atkins. If you have any questions now or well into the future, flick me an email, give me a call, join our mailing list, or listen to our podcast. I'd be so happy to connect with you guys and answer any questions you've got now or anything that comes up afterwards.